Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important and interesting healthcare topics. And boy, do we have an interesting one today. Today, I'm going to be talking with physical therapist Carolyn Weber on the topic of postural restoration, something that may be new to you and I thought was new to me, but I have a connection with it. So we're going to kind of talk through this because we're going to learn how valuable this really is in our daily lives. So thank you so much, Carolyn, for being here to talk about this. I'm thinking, what are we going to want to know about postural restoration, or PRI, as I've come to learn? And so it's so important. So I'm glad you're here to talk about it.
Thank you.
So thanks for being here. So can you start right off and tell us what it is so we can capture our audience and they'll stick with us because it's so important?
Yeah. So postural restoration is really a holistic posture-based treatment approach. It was developed by a physical therapist out in Lincoln, Nebraska. His name is Ron Hruska. And he started this science years ago, trying to understand the human body a little bit better. And what he observed was that there were a lot of patterns that he would see in people's posture and movement and even their respiration. And he was trying to connect the pieces and figure out why this was so. And basically he came up with, he researched it for a long time and came up with very common patterns that we see in people's posture and movement. So he identified them and connected it together to create an evaluation process and a treatment approach to help people with faulty posture and postural adaptations and asymmetries in their body that can affect a lot of different systems. And from there, he created what's called the Postural Restoration Institute, or PRI. And he now offers over 95 courses throughout the country and actually internationally now, where people are really appreciating his science, where these postural patterns are identified and they're treatable, and they're really related to a lot of different disorders that can happen. So musculoskeletal, respiratory, dental, so it's a very interdisciplinary approach.
Wow. So how would I know if that would be helpful? So kind of where does this all start, and can you connect it between, how would I know if I have something wrong of that nature?
Well, most patients aren't necessarily going to know and say, boy, I need postural restoration. But physical therapists who are trained in this approach can identify patients that could really benefit from postural restoration. And it could be anything from people who have oftentimes it's people who have pain somewhere in their body or dysfunction somewhere, and they really can't identify what they did. They didn't have an injury. They just have pain that's kind of crept up over the years. They're realizing that there are some functional things that they can't do that they used to be able to do. And so they may go to their doctor and be identified in some way, but physical therapy can really help by looking at this individual from a postural restoration standpoint and realize that there are asymmetries in the body that actually normally exist, but when they get out of order to a point where they're stressing tendons or joints or causing other disorders in their body, that the postural restoration approach can be very helpful. So a patient may not necessarily know, but if you have therapy with somebody who's trained in this approach, it could really help a wide variety of people.
So when folks have these pains, first they probably think that they start living with it for a while because they haven't had an injury. So if you do go to your doctor, we wouldn't know that we might need that service. So how do the physicians know? Because normally we would go to our physician or versus go to a therapist first.
Right.
I think usually. So how do we make that connection to get to your service? That could be so important.
Well, physical therapy is pretty well known. And so a lot of providers will refer to physical therapy for pain, such as generalized back pain or shoulder pain or neck pain. And it educating the providers that there is this approach available, but physical therapy in general is going to help these individuals anyway. So a lot of these people end up in physical therapy, and this is just one of the many approaches that physical therapy has to help people. And it's just very specific to the postural asymmetries in the body. So there are many different ways we can treat people. This is one of the many approaches, and it's one that I chose to specialize in because I really was drawn to it right from the start, and it really makes sense with what happens with the human body.
So tell me about, what does the evaluation look like? What do you do to evaluate someone for this?
So, for example, if someone was referred to me for, say, low back pain, I would still do my typical physical therapy evaluation. So we always take a very thorough and in-depth history of the patient's health, their activity level, their functional deficits, where their pain is, what causes their pain, all of that. And then we go through and do a regular physical therapy examination where we look at posture in general, we look at their range of motion and their strength. We definitely try to identify where their functional deficits are. But the postural restoration approach just looks a little bit more specifically. There are very specific tests, objective tests that we look at that compare side to side of the body, having to do with muscle lengths, strength. Even visibly, we can oftentimes see asymmetries on one side of the body as compared to the other. And then we can identify what type of pattern they're in, and there are very common patterns that we see in postural restoration. So identifying those patterns and then knowing how to improve their posture so that they can become more neutral. Okay, so we want our bodies to be neutral from side to side. We want to be able to do what we can on the right side of our body as we can on the left side of our body. And it has to do with the strength of certain muscles that might overpower and others that aren't working hard enough. And it's very different on one side than it is on the other because of these patterns. So identifying that and knowing the right exercises to prescribe, which are very specific to certain muscles. And we can also offer some manual therapy that is related to that might help the patient get out of that pattern that they're in and back to neutrality.
So when you identify this, do you have a course of therapy services for them that folks come to you for? And then is there things that we do at home for
Absolutely, absolutely. So like I said, the exercises that are prescribed are very specific. So we're identifying this pattern and we're finding that there are certain muscles that we really need to target and work to regain a patient's neutrality. So we work very closely with the patients in the clinic to try to make progress with their posture, but then they're always sent home with exercises to work on because you're really trying to retrain their body to hold a new postural pattern. So if they do it just once in the clinic and then come back a week later, that's not going to hold. You need constant reinforcement to really have the muscles work. Kind of, similar to if you're going to go to the gym and just try to get stronger. If you do it more often, and oftentimes it's prescribed 3-5 times a week, 5 to 7 times a week, depending on what you need. Well, it's similar with the postural restoration exercises in that you need to do them often to really make the gains. And doing them correctly is important too. So revisiting physical therapy and going over them and then progressing from there is very important as well.
Now, you're certified in this work, correct?
Yes.
And what did that certification, what was that process like, and what have you gained from that certification?
It was an incredible process. So there are core courses that you need to take that are postural restoration courses. So there are 4 or 5 courses that you need to take to qualify to apply for the certification. And then there's an application process that's pretty extensive. So it involves case studies and a lot of research papers and really putting together this portfolio of all of your knowledge. And that gets submitted to the Postural Restoration Institute. And then there's a process where you have 2 analyzers who look at your work and they comment on it. So you have
Wow.
the primary analyzer will go through and make comments, and then the second one will add to it or agree or maybe say something different. But it's almost like a thesis where they're going through and picking apart everything that you've done. And they'll send you back your feedback and let you know if you are prepared enough to go out. In Lincoln, Nebraska is where the Postural Restoration Institute is. And every December they have a certification process out there where you sit for a 2-day exam, and one of the courses that's required to take for the certification is actually out there, and it's called Advanced Integration. So it's a 4-day course you take, and then you can sit for the 2-day exam. And if you do well with all of that, you come home with the certification.
Which you did.
Which I did, yes, just this past December, which is really
Congratulations.
nice. Thank you. Yes.
That's awesome. Yep. So with all that, so as far as referrals, so I'm sure people are listening about, wow, I've got some pains, and maybe I wonder if it's my gait or I'm asymmetric. So what's the referral look like? Can you go directly to you for physical therapy, or should you go through your primary care or orthopedic, or how are you connecting to make sure people are getting funneled to you for this wonderful procedure?
So we always recommend that people get a referral from a provider, so a lot of times their primary care provider, just so that we make sure that they're cleared to do physical therapy in general. And a lot of it is education that needs to still get out there. So a lot of providers are starting to hear more about postural restoration and the wonderful effects that it's had so far. So word's starting to spread, and we oftentimes now get referrals that might say, you know, where the pain is or the problem is, like tendonitis or low back pain or IT band syndrome or whatever. And they know that postural restoration may be a good avenue to take, so they'll add it on to the referral and say, you know, suggest postural restoration.
Excellent.
And we have, at NMC, we have a very large rehab staff, and many of us are getting trained in postural restoration. So we are taking courses and getting more adept at the whole approach, and with my certification, it's even being promoted even more. So so providers are starting to know, but even if they don't know, even if we get a referral that just has the diagnosis on it, you know, if people are on my schedule, I'm most likely going to do PRI with them. If other therapists get them, they've either had a couple of courses under their belt and they can identify that might be a good approach, or we can collaborate a lot of times on patients and help them out together.
Excellent, excellent. So do you have any tips for folks out there that may be listening that maybe have a pain or how to prevent any of these things?
Yeah, I mean, the nice part about postural restoration is it really could help anybody, because and you know, if you have absolutely no pain and you're functioning just fine, it's not really a reason to come in. But if you have more of a, you know, I wonder why this hurts all the time, or why this always feels tight, you know, there's probably a reason behind it. And it would be, you know, worth it for a better quality of life and be able to function the way you would like to without pain, to maybe seek out a referral. So maybe going to your primary care doctor and just say, you know, I really have this, and I've heard about postural restoration, or physical therapy I've heard really good things about, you know, I'd like to try it. So a lot of patients will do that. They sort of are their own self-advocates, and other times, you know, providers might know a little bit more about it first and be able to educate their patients on it. But it is definitely helpful. I've helped a lot of people with this approach, and you know, again, it's very holistic and interdisciplinary, so so it really gets a wide range of individuals.
Wow. Now, where can folks find you? Where are you located?
So I work for Northwestern Medical Center in the outpatient rehab department. I'm currently in our Georgia satellite 2 days a week, and up at Cobblestone 2 days a week. And like I said, we have a large staff, and many of us are starting to use this approach more and more. So there's definitely a lot of help out there for people.
Excellent, excellent. Anything else did I miss that folks should know about this? It sounds you have so much knowledge about this. I want to make sure I didn't miss anything that you think folks should be aware of.
Yeah, I mean, it just could be, you know, I mean, there are typical things we see in people's posture that sometimes people don't even realize. So visibly, you know, things that appear to us with the asymmetries that you may not realize you have a problem with. Like we see rib flares on the left side that we don't have on the right. We see people whose feet turn out more than others. And those are all kind of signs that something's not quite in balance. And so if that goes along with something that you're experiencing, a pain or a dysfunction, you know, again, that might be something to look into so that you can improve your posture and your lifestyle.
Great. Well, thank you so much. And, you know, I must confess, I mean, when I was preparing for this, I'm thinking, because I have gone to see you on an IT band issue, and I did go to orthopedics in my primary care and thought I had a knee injury, and I didn't. And the work that you provided to help me with my, you know, to be more symmetrical, more balanced, has really helped me so much. And as I sit here, I'm not in pain, and I can do activities without in pain, but yet I do some of these things that you showed me still at home, and it's really helpful. So, and it wasn't until we connected here, I'm thinking, this is the work you did with me.
Right.
You didn't tell me exactly, but you just went about your work, and it was pretty amazing.
Good.
So I would recommend it. So thank you very much for sharing all of this with our community. I'm Jill Berry Bowen, the CEO of Northwestern Medical Center, and so glad you joined us for this Health Beat on postural restoration, because it really makes a powerful difference.